We've all had it happen. That surprise nosebleed, a sore throat that just won't quit, or a sudden earache that ruins your day. And most of the time, they're no big deal. But how do you know when it's actually your body sending a serious warning signal? Well, that's what we're going to get into. We're going to figure out when you can just relax and when you really need to act.
It's a real question, right? Knowing the difference between something that's just a simple annoyance and a major red flag, that can be really tough. So we're going to break down exactly what you need to be looking for.
The goal here is pretty simple. We want to give you the information you need to make smart, confident decisions about your health. So you ready? Let's dive in. All right, first up, let's talk about one of the most common and, let's be honest, sometimes scariest issues, the nosebleed. We're going to separate the facts from the fear on this one. And what's wild, when you look at it, is just how common the harmless kind is. A full 90% of all nosebleeds are what we call anterior, meaning they come from the very front of the nose. That leaves only a tiny fraction, just 10%, that are the more serious posterior type, which start way in the back. So that big 90%, well, they all come from this delicate little web of blood vessels called Kieselbach's plexus, and it's located right up front, which is exactly why they're so common and usually so easy to deal with. And the triggers for these are usually pretty straightforward, everyday things. Like nose picking, super dry air from the heat or AC, maybe a cold, or even if you're on blood thinning medications. Any of those can easily kick off one of these simple bleeds. So how do you handle it? Well, it's pretty simple, but there's one step almost everyone gets wrong. You need to sit up and lean forward, not back. That stops you from swallowing blood. Then just pinch the soft, fleshy part of your nose and hold it tight for a full 10 to 15 minutes. No peeking. And hey, if you have an ice pack, putting it on the bridge of your nose can help too. But what about that other 10%, the posterior nosebleeds? Yeah, those are a completely different animal, and they're the ones we need to pay close attention to. See, these bleeds from the back of the nose tend to happen more in older adults, and they can be a sign of bigger issues like high blood pressure or hardened arteries. Because of where they start, they are much, much harder to stop on your own. This is a clear signal that you need to get some medical help. Okay, so we've covered the nose. Let's move on to the throat, because just like with nosebleeds, not all sore throats are created equal, and knowing the difference here is absolutely critical. This chart lays it out perfectly. On the left, you've got your run-of-the-mill tonsillitis. General pain, red tonsils, maybe a fever. But look at the right side. That's something called quinsy, which is a serious abscess. The signs are totally different. The pain is severe, and it's only on one side. You might see swelling that literally pushes your uvula, that little hanging thing, off to the side. And you might even have a hard time opening your mouth fully. That's a big warning sign. And here is a fantastic and kind of funny way to remember a major clue. If someone's voice suddenly sounds muffled, like they're trying to talk with a hot potato in their mouth, that is a classic red flag for quinsy. It means there's a ton of swelling back there that's blocking up all the space. So while we're on the topic of throats, let's talk about losing your voice. Hoarseness, it's usually just from a cold or from yelling too much at a concert, but there's one hard and fast rule you have to remember. If your voice is hoarse for more than 3 weeks, that's it. That is your non-negotiable signal to go see a doctor. All right, for our last section, let's talk about earaches. The pain can feel really similar for different problems, but where that problem is happening, well, that makes all the difference in the world. This comparison is so key. Swimmer's ear, that's an infection of the outer ear canal, and the telltale sign is pain when you tug or press on your ear. A middle ear infection, on the other hand, is behind the eardrum. It often shows up after you've had a cold, and it won't hurt when you pull on your ear. It's a really simple test that can help you tell the two apart. Of course, not every ear issue is a painful infection. You've also got something called presbycusis, which is really just the technical way of saying age-related hearing loss. It's not sudden, it's a very gradual thing that happens in both ears. You might first notice that you're having trouble hearing higher-pitched sounds, like birds or certain conversations. Okay, we have covered a lot of ground here, so let's bring it all home and boil it down to one final, super important summary of the biggest warning signs. Think of this as your essential takeaway checklist. So let's lock this in. These are the red flags that mean you need to see a doctor right away. First, a nose that's blocked up and bleeding, but only on one side. Second, any kind of hoarseness that just hangs around for more than 3 weeks. Third, that severe one-sided sore throat, especially with that hot potato voice. Fourth, and this one is tricky, a really painful ear that actually looks totally normal to a doctor. That can mean the pain is coming from somewhere else. And finally, any kind of facial weakness or drooping that happens along with ear symptoms. You just can't ignore these signals. At the end of the day, your body is always communicating with you through these symptoms. The trick isn't to panic every time. It's to understand the language it's speaking. So the real question is, now that you know what to look for, are you ready to listen?